rinse your mouth, and then you begin from one end. And when you begin, you angulate your brush at, we say, 45 degrees to the tooth.
Fluorosis basically is caused by high levels of fluoride from different sources.
In Kenya today, the health of our teeth tells a deeper story, one that reflects our habits, our access to care, and even the water we drink. Cavities, the world's most chronic disease, continue to affect children and adults alike, often quietly eroding smiles and confidence. At the same time, in parts of our country, another challenge is quite literally etched into our enamel: fluorosis. It is a condition caused by excessive fluoride exposure, leaving permanent marks on the teeth and, in some cases, more than just cosmetic damage. In this episode, we journey into the University of Nairobi Dental Clinic as we uncover the double burden of tooth decay and dental fluorosis in Kenya. We speak to dentists to understand the causes, the consequences, and most importantly, their solutions. From sugary diets and poor oral hygiene to high fluoride groundwater and limited access to dental care, we explore how two seemingly opposite conditions are affecting generations and what can be done to protect the nation's smiles.
My name is Professor Regina Mutave. I am a dentist to start with. I am a public health specialist and a consultant in community and preventive dentistry. I am an associate professor at the University of Nairobi, where I teach students, both undergraduates and postgraduates, on mechanisms of working with communities to prevent diseases and promote oral health. Oral health deals with the health of your mouth and structures that are found in that region of your face. So we're talking about you having very good teeth. We're talking about them being disease-free. We're talking about other structures in your mouth, the tongue, the gums, the palate, your lips, your face, really being in good health.
Tooth decay is a growing public health concern in Kenya, affecting both children and adults across the country.
Tooth decay basically is a disease that affects the hard tissues, or the teeth for that matter. So basically the tooth is divided into different aspects. So the outer aspect is the enamel, then we have the dentin, and going all the way to the pulp.
Tooth decay is actually caused by an interaction between some bacteria that live in our mouth. There are certain bacteria that when they are supplied with sugar in the mouth, they will attach themselves on the tooth and they will continue working on the sugar and forming some acid as a byproduct of that process. And it is that acid that ends up causing an erosion on the tooth, and slowly the tooth begins to have a cavity, and the cavity continues to get bigger as long as we do not take any measures to prevent it.
Tooth decay is a significant public health issue in Kenya, affecting both children and adults. Regional disparities exist, with certain areas exhibiting higher prevalence rates.
Tooth decay, by the way, is one of the commonest diseases that we encounter as dentists. Let's speak very specifically about a survey that was done in 2015. We realized that half the children aged 5 years had tooth decay. We can say about 3 out of every 10 adults also have tooth decay. So it might vary. Somebody might be having one tooth decayed, another person might have 5, 8, 10 teeth decayed.
Now, while tooth decay is caused by the breakdown of tooth enamel, dental fluorosis is a condition that results from excessive intake of fluoride.
Fluorosis basically is an irreversible disease that affects the hard part of the tooth again. And fluorosis basically is caused by high levels of fluoride from different sources. Mainly we get it from water because that is where we get high levels of fluorosis, but fluorosis can also come from different other sources, okay? We can get it from food, especially the seafoods or the food that we grow in regions that have high levels of fluoride, then we're able to get fluoride from food.
High fluoride in water is tasteless. It's not like having sodium, which, you know, you'll taste the salt. Fluoride is tasteless. If you boil that water, you concentrate it more. So you're not removing fluoride by boiling water. And so it is a very silent thing.
Fluorosis may appear to affect only the surface of the tooth, but in reality, it occurs deep within the animal during its development.
The brown color doesn't appear immediately because the brown color is a function of different foods and stains that you pick. But when the tooth is formed inside the bone, the layer is not nicely continuous the way your normal tooth is. So your normal tooth is nice and smooth. But this tooth was formed with gaps, so we say it's porous. They look like chalk. That's the kind of whiteness they have. And so it is inside the tooth structure.
What we are noticing is that with the progressive digging of boreholes, especially in some of our cities, some of the water that we get from these boreholes have significantly high levels of fluoride.
I'll talk about the Great Rift Valley because it's the rock that is below the surface that we may not be aware of. And the rock that is volcanic rock is really the one associated with high fluoride in water. So you find all the lakes in the Rift Valley, Baringo, Nakuru, they have very high fluoride in their water. The WHO recommends that you don't exceed a fluoride level of 1.5 milligram per liter. We have seen boreholes in Nairobi where the fluoride level is 10 milligram per liter. We know most of Kilimani area, most of Langata area, Athi River, Ruai, Utawala, most of Rongai, all those areas, the water is likely to have high fluoride. And so people settling there, they need to take measures to make sure that they can defluoridate their water or ask for supply of water from other sources that are not boreholes. Because most of those boreholes, the developers are not installing the defluoridation mechanisms because they are a little expensive to install. But then our advice is that all those developers who are using boreholes must test the water, confirm the fluoride content, and defluoridate it at source. Otherwise, you are pumping it to unsuspecting users who only realize that the water was not suitable 7 years down the line because fluorosis doesn't show immediately. If you have a baby that is born in Kilimani and they grow up, you'll only begin to see the effects when the baby is about 7 years to 8 years. That is so late, you can't do anything, you can't reverse.
Now, how do cavities present?
Potentially when the cavity is beginning, you may not be able to pick it out. Sometimes you may not feel any pain. Okay, what you could be able to notice is you might notice some discoloration of the tooth. As it progresses now into the dentin levels, aspect of sensitivity could come in. You might have difficulty in chewing or taking some foods. And then now when the cavity progresses further into the pulp, then that is a deep cavity and the infection could get into the pulp and now cause severe pain.
With fluorosis, the symptoms are much more delayed.
It will not show you any signs. The reason why we see it when the child is 7, 8, is because that's when the permanent teeth come out. The first set of a baby is formed when the baby is in the mother's womb. Very little will have passed through the placenta. But the second set, because the child is eating food that is being cooked in that house, drinking water that is available in that house, then that is the second set begins to form when the child is about 1 year old. And so the tooth is formed very slowly inside the bone. By the time we see it in the mouth, it's about 6 years, 7 years, 8 years. That's when we begin to see those teeth.
The diagnosis of cavities involves a combination of visual inspection, physical examination, and sometimes dental imaging.
When you come and you have no signs or any symptoms, then we'll just take some x-rays that are able to show us whether there's any decay happening. You have areas there that you cannot see. You cannot see in between there. And so those ones will take an X-ray, and it tells us if there is any place where cavity may have started. But the front ones here, we can literally see with our naked eyes.
The treatment of cavities depends on the extent of the tooth decay, but the goal is always to remove the decayed material and restore the tooth's function and appearance.
Most cavities that have not progressed beyond the dentin, we do fillings. But then if a cavity has progressed a great deal and we may not be able to, a filling on top will not remove the infection inside the root, then we will tell you we are going to do a root canal treatment. But that's on the assessment that even after we've done a root canal treatment, we'll be able to put a filling on the tooth. We don't like to remove teeth. We remove teeth as a last resort. When a cavity is very early, just beginning, like we can see it's still within enamel, we can even just strengthen your tooth using some fluoride application. And we can observe and be sure that your tooth is not progressing.
The treatment of dental fluorosis is mostly cosmetic and aims to improve the appearance of the teeth rather than altering the already damaged internal structure.
Fluorosis is irreversible. We have different treatment modalities at different levels, depending on the severity, because when you come to us, we're able to classify. Sometimes we don't do any treatment, we give further advice so that you're able to prevent further effects on children. If it's still mild, also what we can do, we have different interventions. We can do whitening. We give you bleaching agents that are able to help improve the color. However, there are some severe levels that will not respond adequately now to those interventions, and therefore we move on now to other interventions like what we call masking. Masking, basically what we do is that we bring a filling and cover the tooth. So we make just a small preparation on the tooth, and we cover the tooth with a whitening or a white material that you're able to improve the aesthetics. Moving further, sometimes also we can do veneers. So we prepare the tooth and then we place the veneers on the teeth. Sometimes also when it is affecting the tooth so much, then we might have to do crowns. And basically, that is more destructive. As we progress in the levels of management, the level of destruction of the tooth, continues in that manner.
Many people brush their teeth too quickly or with a wrong technique, missing spots and leaving plaque behind. Professor Regina shows us the right technique.
You need to rinse your mouth first. We use toothbrush, and you should use toothpaste with fluoride, whether your area has high fluoride or not. We dispense just about a pea size of amount of toothpaste. Rinse your mouth, and then you begin from one end. And when you begin, you angulate your brush at, we say, 45 degrees to the tooth, because then you need to make sure you clean, including the gum, yeah? And so you brush in circular motion, and you make sure every tooth is reached. You must try to, you realize I cannot tilt my head, so I'm now going to change my hand and try to brush again like that. And I'll brush all the way, I'll brush until I reach the end. And then I need to brush the inner side of my teeth. I'll need to brush, and this area you sweep out a little bit like that and continue brushing until the very end. Remember, your back teeth have a biting surface, so you must brush the broad biting surfaces of your teeth, okay? And you repeat the same for your upper teeth. Again, semicircular motion, because your gum here is not straight. So the minute you brush straight, you leave the edge without being properly cleaned. So you must make sure you brush, and I keep trying to imitate the way my mouth should look like, and brush the inner side as well. Brush the inner side, and sweep away at the front teeth. Brush the inner side, turn your brush, and brush the biting surfaces of your teeth. The last thing you do is you brush your tongue. Some of us may not be able to brush this far, but you brush the accessible part of your tongue, which is not going to cause you to feel like vomiting. Thereafter, you're supposed to just spit and then wash out whatever is on your lips. Do not rinse your mouth after you brush. There are areas you can't reach with your brush, so you floss them. On average, it takes us 2 minutes to brush your teeth.
Coming up after the break.
Usually we start early.
So the paste I'm mixing is a filling material.
You can see he has moderate fluorosis here.
We've seen how something as small as a cavity or as silent as fluorosis can have a big impact on your oral health. But the good news is both are preventable with the right care and knowledge. After the break, we'll explore how to protect your teeth, the role of diet and hygiene, and what to expect when you visit the dentist. Stay with us. And now for a short healthcare tip. One important dental healthcare tip is to brush your teeth at least twice a day using a fluoride toothpaste and to floss once daily. Brushing removes dental plaque and food particles from the surfaces of your teeth, while flossing reaches the spaces in between that your toothbrush cannot. Together, these habits help prevent cavities, gum disease, and bad breath.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we uncovered the hidden threats of tooth decay and fluorosis. Now, let's shift gears and focus on solutions. How to care for your teeth the right way, the importance of early dental visits, and the simple habits that can make a lifetime of a difference.
So I don't want us to think about dental fluorosis as an issue of the rural areas. But number one, the Ministry of Health in 2022 developed a Kenya National Oral Health Policy. And in that policy, they have put it clearly that drinking water should contain no more than 1.5 milligrams of fluoride in every liter. And so that is enforceable. That now we should be able to, if you are digging a borehole and you have your water taken for analysis, if it is more than 1.5 milligrams per liter, you should be able to inform anybody who is using that water that this water, you must use it first of all with caution and not for drinking or cooking for children, because that is the first way, making sure that there's information that this water is not safe for growing children. But number two, government should move a notch higher and improve the regulation. Make sure that that water which is not suitable for drinking can be taken through the processes that clean it and can present it clean to the residents, to the population. And number three, then government should prioritize providing water resources from good sources for those people whose environments are having water with high fluoride. Because boreholes are not going to be a solution for this country. We need more surface water kind of harvesting, and so that you can be able to ensure that you can have safe drinking water that is not affecting people.
Tell me about the stigma that the children go through.
Well, it is a recognized issue that the minute that one's teeth don't look like the normal, what is considered normal, it can easily cause stigma. Right now we see that there's not very good coverage of insurance for treatment of dental ailments. Yet a child who is born and grows up now with dental fluorosis has to wait until their parent finds money for them to get treated. So it is discriminatory. It should be brought forth and prioritized as an issue that is affecting our children. If we cannot prevent the occurrence of dental fluorosis, let us make the treatment for dental fluorosis available for our children so that they can also enjoy the life as the others.
And at what age can it now be corrected cosmetically? From what age?
Usually we start early because we don't also want the children to go through part of their life. Cosmetically we begin to work on it from about 10 years, 9-10 years, early teens.
On this particular day, a young man visited the dental clinic seeking care for the symptoms of fluorosis and a misaligned canine tooth. We speak to his mother.
I'm Sarah Weru. I'm mother to Ray Carson, and we are here at University of Nairobi Dental Hospital. We had an appointment to bring Ray today. Initially, he didn't have canines. There was no space in his teeth, so he was given a spacer, but there's still no space between where they're supposed to be located.
Today, I'm doing an orthodontic examination. My patient's chief complaint is crowding, malalignments on the upper segment, upper jaw. So, and the teeth, the canines have been displaced towards the lips. So I'm here to have a check on it. How are you, Ray?
Fine, thank you.
Okay.
Yes.
So I want to look at your teeth. Okay. Are you comfortable with it?
Yes.
Should I go ahead?
Yeah, you can.
Okay. Thank you. You can see he has moderate fluorosis. Yeah. Then his canines have been displaced towards the gingival area, okay? They're still erupting, okay? Again, fluorosis, dental fluorosis. Then the second premolar is erupting, yeah, with the crown already within the oral cavity. Then he also has mild crowding on the lower anterior region on the mandible. No decay for him, yeah. So also the upper right canine is erupting, and again it is erupting labially. So we need to correct these in good time, yeah.
The dentist will now develop a treatment plan for Ray. Next, Dr. Nuru walks us through the final stage of a root canal procedure. The patient has already had 2 previous appointments, and today marks the completion of the treatment. He initially came in with a throbbing toothache.
The tooth was giving him trouble or giving him pain. And we established that the tooth had a cavity which was very deep, involving the pulp. The pulp basically is the life part of the tooth, which has the nerves and the blood supply, or the life part of the tooth basically. So when the cavity had extended to that region, there was also symptoms which informed us that there could be an infection happening, which has already extended to the root or the apex of the root. And therefore, the treatment modality that would be appropriate for such kind of cases is to do a root canal treatment. And the root canal treatment basically is to access the life part of the tooth, be able to clean it completely, clean out the bacteria which is causing the disease. And we have been able to do that. And for the previous visit that he has come, this is the third visit. We usually do it in different visits. So by the time that we are doing the final stage, which we are doing today, he is free of pain. And we have been assured that we no longer have any infection activity going on. So today we have already sealed the roots. Now I want to go ahead and do the final restoration. That is the final filling or the permanent filling. And from this visit, we will be done with that tooth and we'll be moving to other aspects of management and treatment. What you're seeing, the green sheet that you're seeing over here, is called a rubber dam. So the rubber dam sheet basically is to protect or isolate the tooth. So the tooth is isolated from the rest of the teeth and generally the oral cavity. As you would know that the oral cavity has normal flora and other flora, which we don't want it to go into the canal. So if it goes into the canals, they could potentially cause infections. So the paste I'm mixing is a filling material, which will harden once I put into the cavity, into the orifices, or just to where the roots are opening into the pulp chamber. There are orifices that need to be sealed. So I'm using this to seal that section. Then I'll use another restoration to do the permanent filling. So we are now sealing completely. So that is sealed completely. So I'm adjusting the restoration now so that I'm able to do my final restoration.
We leave the dentist to finish the procedure. This will be the patient's final visit, and he will leave having an infection-free tooth whose structure has been restored. Now, how can we protect our teeth from both fluorosis and cavities?
You can take the water, you can take a sample to a laboratory, they can tell you how much fluoride that water has. And there are solutions, a bit maybe some costly, but there are solutions where you can do just a domestic installation on your tap, and it will be able to clean the water for your cooking and for your drinking.
What we are recommending that even expectant women would need to watch, the amount of or the levels of fluoride in the water that they are taking, because that will be transferred to the baby.
Cavities and fluorosis may look different, but they do share a common thread: how we care for our teeth, what we eat, and even the water we consume. As we've seen, early intervention and access to dental care can make all the difference. Thank you for watching, and remember, your smile deserves care, attention, and a little more love every day.